What is silent reflux? What are its symptoms? What causes it? And what are the treatments?
What was the question was, what is silent reflux?
Yes.
Okay. Well, that is something I see a lot when I have a patient that is sent from sort of ENT sometimes, where the patient will go in for hoarseness or some other symptom or cough. And during that sort of workup, they've been seen by an ear, nose, and throat doctor and had sort of an exam there first. And sometimes they'll see commonly redness on their vocal cords, and they say, well, maybe you're having silent reflux, right? And so the patient will say, well, no, I don't have any symptoms of sort of feeling like they have a sour sensation in my mouth. I don't feel food coming up after I eat. I don't have any symptoms of sort of that burning sensation. I don't have those symptoms. So that's why they'll get the name of sort of what is a silent reflux. Sometimes they're put on, by the time they see me, usually somebody has put them on an acid reducing medication, either a proton pump inhibitor or an H2 blocker. And usually are coming to see me to say, well, do I have this? What else do I need to do? And so what I do is a history first. What symptoms are you having? What prompted you to start having workup in the first place? And then we go down the road of trying to understand if you actually indeed have reflux. Sometimes patients will have an ENT exam, and just because you have, red vocal cords is pretty subjective sometimes. Doesn't necessarily mean it's from reflux. So sometimes we'll do, based on symptoms, I'll get people off medications, do some dietary changes, talk about things that could possibly be triggers. Sometimes reflux can sort of have atypical sort of presenting symptoms, like waking up with a sore throat or having a sour mouth or cough. Or hoarseness or anything, one of those things. And so we'll do an upper endoscopy first to see if there's any sort of damage to the bottom of the esophagus that could be caused by sort of a constant acid exposure called esophagitis. And there's a grading criteria that we have. If a person has a hiatal hernia, they're sort of more at risk for having sort of their bottom of their esophagus sort of bathing in that acid. And sometimes doing sort of some specialized testing like Bravo studies, which is a little camera, a little test that we can sensor, we can put in the bottom of the esophagus to measure that acidity as well, or a pH impedance probe, which also this one's a little bit cooler because you can press a button when a patient has both, actually, when you have symptoms, and it sort of can send that will be able to measure exactly what your pH is at that time, to be able to correlate as when you're having symptoms in actual time and when you have a very low pH. This is how we're able to decide if your symptoms that you sort of initially presented with are actually due to acid reflux or not. And so I think that is what's commonly sort of known as sort of silent reflux. There's also other sort of things that talk about non-acid reflux as well. So that is when we use those similar tests to determine if what patients are feeling is actually due to sort of acid, or is it just a sensation where they're hypersensitive, where they feel something going up into their esophagus, but it's not actually it's something that's acidic.
And just one thing to add to that is that if there's a concern about silent reflux, or ENT does see something and there's concern of reflux, if we do an endoscopy, which we usually will, if there is something called Barrett's esophagus, those are cell changes that occur in the bottom of the esophagus that put you at increased risk for developing esophageal cancer. So many patients might have silent reflux, but they're actually having acid events that are affecting the esophagus. And those cell changes can be quite dangerous. So it just needs to be monitored closely on the right medications and repeat endoscopies to make sure that it doesn't turn into esophageal cancer.